Let's turn to the latest on the coronavirus outbreak. So confirmed cases around the world now topping 2 million. Here in the U.S., we've been talking about the severity of the outbreak here in the United States. That number now topping over 600,000 confirmed cases. But even though amid this tragedy, there are some more signs of optimism in some of the nation's hardest hit cities. Now here for more on this, I want to bring in Dr. Harlan Krumholz, director of Yale New Haven Hospital Center for Outcomes Research and Evaluation. We're also joined by Yahoo Finance's Sibile Marcellus. And Dr. Krumholz, lots to talk with you about just in regards to where we are in fighting this virus. But as it stands now, the progress that we have made over the last couple of weeks, do you think it's fair to say that we've turned a corner at this point?
Well, I think we can be proud of some of the progress that's been made, the way that the American people have come together to follow the guidance, the way in which the social distancing has spread throughout the nation and that people have come on board with it. What we're seeing now, and I think what most experts believe is the fruits of that, that we have been able to flatten the curve, that we've slowed down, but realize that this progress has come at a great cost and with a strategy that's not sustainable. So we've done this by separating. We've done this by slowing the spread, by less interaction. And I think that it's placing us in a position now to try to determine what are our next steps, because this was a temporizing, measure. It was a way to try to manage a situation that was becoming unmanageable, especially in certain places like New York, where we feared that we would be overwhelmed and that the hospitals would be unable to keep up. So now we're thinking hard about what's the next step? How do we move forward? So, I think everyone's happy to see this, but no one's congratulating themselves, and no one feels comforted by this any more than just to say that we bought ourselves some time, that we've been able to manage some of the short-term risk, but the long-term risk still hovers over us. And on this show, you talk a lot about financial risk. As a physician and healthcare professional, we worry about health risks, and that still hovers over us. And so we're trying to determine how can we safely, move forward and change the status quo and get people back, but do it so in a safe way.
So a lot of the conversation, Dr. Krumholz, about returning people to work has been about having some kind of nationwide testing system that we can trust. Now, what I found interesting was that you were saying that testing negative for the coronavirus does not mean that you don't have it. So can you explain that to us and what that actually implies?
Yeah, so I wrote a piece in the New York Times where I was trying to convey to folks that we need to be able to know how to properly interpret the test results, and especially the early test results. Best that we could tell, both information from China, Europe, and the United States, was that in too many cases, that the test was coming back negative when the person likely was infected. Now, let me just say, that's not to undermine confidence in the test. Test comes back positive and people have symptoms. Most likely that's telling us the truth. But what we found were there were a lot of asymptomatic people without symptoms walking around who were feeling fine, who actually were infected by the virus. And so in surveillance or among people who were sick and had classic symptoms, even X-ray findings, were testing negative. And so it looked like maybe one in three, 1 in 4 people who were testing negative might in fact have been infected. And the problem is that we really were having trouble putting our arms around exactly what were those numbers. So what I was trying to do was just to tell people that, for people with classic symptoms and in the midst of a pandemic, being told that your test is negative doesn't necessarily mean that you don't have the virus. It just means that the test came back negative, and that we need to know that there's some level of uncertainty. Now these tests are progressing. Technology is getting better. You have to know one of the problems is that the current test requires you to stick a swab way up into the back of the nose. I don't know if you've seen this, but this is really uncomfortable and not that easy to obtain. It's not just about taking a swab from the nose. It's going way in the back. And some of our thought was that, many people who were doing this weren't as skilled in obtaining these samples. And so that if they weren't getting a good sampling, then that might have been the reason that the tests weren't showing up positive. So, the new tests, we're talking about saliva tests now, we're talking about, finger prick tests and others. Those may also help us to improve the information that we're getting from them and may help us get better. But yeah, the current tests that we have going to the way back of the nose, way back of the throat, if they're negative, it doesn't always mean that the person doesn't have the virus.
Dr. Krumholz, I want to go off of just our access to testing at this point, because that has been at the crux of this issue now for several weeks. And it was interesting. I was reading in Politico this morning. There was a study that they referenced. It was from the American Clinical Laboratory Association. And the members of that association include Quest, they include LabCorp. They actually reported that the number of coronavirus tests analyzed each day by commercial labs in the U.S. plunged by more than 30% in the past week. From your understanding of what's going on, where do we stand in our ability to get some tests? And are there still glitches in the U.S. testing system at this point?
So we're pushing as hard as possible. And one of the problems was from the very beginning, we didn't have enough tests. I mean, it was really remarkable. Even when you're reporting the number of confirmed people in the country who have been infected by the virus is likely a gross underestimate. It just depends on who's had access. And, you know, most places around the country, including my own place, still have constraints on that. We still don't have enough. It's not a matter of being able to test everyone that we want to be able to test, let alone get out into the communities and test people without symptoms as well. So we can have a sense of what is the prevalence. How many people in our communities without symptoms at all are infected? Give us some sense of what the spread is and how fast that's changing over time. So, you know, many of us are pushing really hard to say, you know, we need this information. We need to make wise choices ahead. We need to be able to understand what's the extent of the virus today. And also that information tells us something about risk, because without the denominator, without knowing the full number of people infected, it's hard to understand risk because you can't tell what the real rates are. So, you know, all of us have been pushing hard. The companies that produce these tests have been pushing hard. And what I think we're seeing is within the next 4 weeks, we'll see a remarkable increase in the availability of these tests. Still may not be as many as we'd like, but I hope we get to a point where any American who wants to be tested can be tested. Any physician who has a patient who they want to be tested will be easily able to get them tested. And so a combination on the clinical side and the hospitals and clinics and on the public health side, we're going to need this information to make smart choices. And I am seeing, you know, plans and projections that we're going to have finally the number of tests that we need. The question is going to be, as they go quickly through the FDA, validating them, making sure that they're trustworthy. I've already talked about false negative rates to make sure that we know their performance is good. But I'm confident, actually, that we will soon have enough tests.
So I know that you're a cardiologist, and White House trade advisor Peter Navarro has said that the shutdown could be deadlier than the virus itself. And he said that medical experts are tone deaf to this. So as a medical expert yourself, is there a risk when it comes to shutdown to people's health from an economic standpoint? Impact?
Yeah, and I'm not sure why he says that. I think most of my colleagues and most folks that I've talked to around the country, we're all very sensitive to the fact that the virus can be deadly both for its direct and indirect effects. I mean, the direct effects are, what does the virus actually do if you get infected? What kind of risk are you at? But we also know that in a period of social distancing, people are afraid to come to the hospital, where we're no longer, as doctors, being able to see, you know, patients in ways that we have traditionally done. And, you know, and patients maybe not getting access to their meds, being afraid even to going out to pharmacies. I mean, there's all sorts of secondary effects here that can be at play that put people at risk because they have trouble managing their diabetes or their heart disease or their heart failure, or a whole range of conditions that they require them to have easy access to meds and easy access to the healthcare system. And we're doing our best. Telemedicine's taken off. We're trying to make sure people get their meds, but he's not wrong. This is something we've got to be very sensitive to. And as we look at what's going on, we need to be able to measure and monitor, you know, where's harm occurring? What can we do to mitigate that harm? And how can we move quickly to address issues that are standing in the way between people and their health? But yeah, I think that I don't know anyone who's not aware that it's not just the direct effects of the virus and the devastating effects that it can have on people and the risk that it puts them at, but that there are plenty of other people. And I wrote about this in the New York Times, where I said heart attacks are going down in the country. And one of our fears is that people are staying home. That they're having chest pain and staying home, or they're having severe acute emergencies and delaying, and as a result, putting themselves at greater risk, and that's likely also contributing to an indirect rise in the rate of deaths, in addition to what's happening directly from the virus. So we need to reassure people. If you have an emergency, while I'm on, let me just say, people, if you have an emergency, hospitals can care for you safely. Look, if you can stay home, that's great. If you can manage it through telehealth, that's great. But we are making sure people know, don't stay home because you're afraid if you've got crushing chest pain, if all of a sudden you're short of breath, if you're having trouble speaking, symptoms of a stroke, if your belly is acutely, painful. These are things that, modern healthcare can help you with. And the hospitals are equipped to take care of people in emergency. So, this is preventable harm, and we do not want that secondary death toll to occur because people were afraid during this period when actually hospitals can care for people safely.
Dr. Krumholz, going off of that, just making sure that we are able to tackle this disease, that we do it in the most efficient way possible. I need to bring up the fact that President Trump cutting funding for WHO. If you're doing this in the middle of a pandemic, what's the impact of fighting this virus, not just on a national scale, but on a global scale?
Yeah, I would just express that this is a time when all across nations we need to hold hands and work together. This is a time where knowledge should travel easily across borders, and we need to be able to solve this crisis by putting every single person across the world, together in this and learning from every different experience, and especially those that come before us and those who are going to come after us. We need to be able to contribute as a world community. There may be beefs that people have with organizations like WHO, but at this moment, it's time for us to pull together, to support each other, and bring the beefs, talk about them when you want, but we're in the midst of a battle right now. And in this battle means that we need to all pull together, and we need to, work together for common good. So I feel strongly that this is a time that put aside, any sort of disagreements and come together and work together, because this is a worldwide threat, and a threat anywhere is a threat here, and a threat here is a threat elsewhere. And we can learn together, and work groups like the World Health Organization we need at this moment to help draw those connections. And I hope that maybe he can send a message that he was disappointed, but I hope that the United States will continue to be supportive of organizations that are connecting across the globe at this moment, like the World Health Organization, in order that we can channel important information together and feel as one as a world community in fighting this virus.
Yeah, I certainly agree with that, especially with worldwide confirmed cases topping 2 million. Needs to be addressed very quickly. Dr. Krumholz, thanks so much for taking the time. I know you're extremely busy, so thanks for taking the time to join us this afternoon.
Oh, it's a pleasure. Thank you so much for allowing me.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.